तो देखते हैं, साथ के साथ आप आंसर कमेंट करते जाइए। तो हम यहाँ पर पीवाईक्यू करेंगे कौन से सब्जेक्ट के, साइकेट्री के। तो साइकेट्री हम स्टार्ट करेंगे यहाँ पर, जो कि एफएमजी और आपके नीट पीजी दोनों के लिए बहुत इंपॉर्टेंट है। चलिए फर्स्ट क्वेश्चन, आराम से करेंगे, कोई जल्दबाजी नहीं है, आराम से टाइम लेकर करेंगे, कहीं की जल्दी नहीं है अपने को। तो फर्स्ट क्वेश्चन, अ 40-year-old male patient admitted to the ICU 3 days back with breathing difficulty was noted to be restless and having diffuse tremors. He complained to the dusty nurse and he is seeing insects crawling on his bed and body. He had one episode of seizure, which was controlled on lorazepam. On probing further, it was found out that he is a chronic alcoholic. What is the likely diagnosis? Option A, ICU psychosis. Option B, alcohol intoxication. Option C, Wernicke-Korsakoff psychosis. Option D, delirium tremens. जल्दी से कमेंट करके आंसर बताइए फटाफट, जब तक वॉइस चेक कर लेते हैं हम। जल्दी से फटाफट आंसर बताइए। जब आपका गेम टॉप पे हो कोई आपको रोकने नहीं। चलिए दोबारा एक बार क्वेश्चन बोलता हूँ फटाफट। A 40-year-old male patient admitted to the ICU 3 days back with breathing difficulty was noted to be restless and having diffuse tremors. He complained to the dusty he complained to the duty nurse that he is seeing insects crawling on his bed and body. He had one episode of seizures which was controlled on lorazepam. On probing further, it was found out that he is a chronic alcoholic. What it what is the likely diagnosis? Option A, ICU psychosis. Option B, alcoholic intoxication. Option C, Wernicke-Korsakoff psychosis. Option D, delirium tremens. So the right answer is delirium tremens, option D. चलिए नेक्स्ट क्वेश्चन पे आगे बढ़ते हैं। What is the most common emotional state? What is the most common emotional state? Option A, love. Option B, hate. Option C, anger. Option D, anxiety. So the right answer is option A, love. Love is the most common emotional state. चलिए नेक्स्ट क्वेश्चन पे आगे बढ़ते हैं। A 35-year-old woman presents to the psychiatric OPD with decreased sleep and talkativeness for 1 month. She is shouting at the nurses and is uncontrollable. She also complained of irritability and distractibility. She has no treatment of choice in this space. Sorry, she has no previous medical issues. What is the treatment of choice in this patient for this acute state? Option A, lithium. Option B, lorazepam. Option C, carbamazepine. Option D, haloperidol. So क्या लगता है आपको आंसर? जल्दी से फटाफट क्वेश्चन दोबारा रिपीट कर रहा हूँ फटाफट। A 35-year-old woman present to the psychiatric OPD with decreased sleep and talkativeness for 1 month. She is shouting at the nurses and is uncontrollable. She also complained of irritability and distractibility. She has no previous medical issue. What is the treatment of choice in this patient for this acute state? Option A, lithium. Option B, lorazepam. Option C, carbamazepine. Option D, haloperidol. So the right answer is haloperidol. थोड़ा इसका एक्सप्लेनेशन देख लेते हैं क्यों है, जो कि हिस्ट्री में दे रखा है। डिक्रीज स्लीप, talkativeness, irritability, and distractibility present at least 1 week is characteristic of mania. She is an acute mania phase, and the treatment of choice this patient is haloperidol as it has both anti-manic and antipsychotic effect. चलिए इसमें डिफरेंशिएशन और देख लेते हैं मेनिया वर्सेस हाइपोमेनिया में क्या होता है। तो मेनिया सिम्टम्स फॉर एट लीस्ट 1 वीक, और वहीं हाइपोमेनिया की बात करें तो सिम्टम्स फॉर एट लीस्ट 4 डेज। वहीं मेनिया की बात करें तो मार्क्ड इम्पेयरमेंट इन सोशल और ऑक्यूपेशनल फंक्शनिंग। हाइपोमेनिया की बात करें नो इम्पेयरमेंट इन सोशल और ऑक्यूपेशनल फंक्शनिंग। वहीं मेनिया की बात करें में नीड हॉस्पिटलाइजेशन, और हाइपोमेनिया में कोई जरूरत नहीं होती है हॉस्पिटलाइजेशन की। चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं। A 21-year-old girl suspects that the college principal is making a conspiracy against her and is planning to fail her in the upcoming exam. She feels that other teachers have also joined the conspiracy and students are helping them too. What is the diagnosis? Option A, thought insertion. Option B, delusion of control. Option C, delusion of persecution. Option D, delusion of reference. आंसर कमेंट करिए फटाफट। सो द राइट आंसर इज ऑप्शन सी, डिल्यूजन ऑफ persecution। थोड़ा एक्सप्लेनेशन देखते हैं। Thoughts of being harmed by people around themselves represent delusion of persecution is the most common type of delusion. Basically, the delusion is a false form, a fixed, unsecular belief which is not in keeping with the patient's social culture and educational background. चलिए आगे बढ़ते हैं। Next question. A 13-year-old boy was brought to the child psychiatrist by the parents. The parents reported that child lies frequently at home and in school, misbehaves with the teacher, often bullies the youngest kid, and has been caught stealing money on multiple occasions. What is the likely diagnosis? Option A, oppositional defiant disorder. Option B, conduct disorder. Option C, antisocial personality disorder. Option D, disruptive mood dysregulation disorder. क्या लगता है? So the right answer is option B, conduct disorder. चलिए थोड़ा explanation देखते हैं। Misbehaving with people, bullying and theft for the last couple of years point towards a diagnosis of conduct disorder. बेसिकली जो चीजें चुराते हैं, थीफ ये चीजें करते हैं बच्चे, उसे हम कंडक्ट डिसऑर्डर बोलते हैं। नेक्स्ट क्वेश्चन। A 31-year-old female with a history of a recent divorce presents to emergency with complaints of palpitations, sweating, heaviness, and pain in the chest. She has had multiple similar episodes in the last few weeks. The blood investigations and ECG are normal. In the past too, investigations revealed no abnormality. What is the next best step? Option A, admit for detailed investigations. Option B, start counseling session. Option C, use beta blockers. Option D, use benzodiazepine for symptom relief. चलिए क्वेश्चन दोबारा बोलता हूँ एक बार और. A 31-year-old female with a history of a recent divorce presents to emergency with complaints of palpitation, sweating, heaviness, and pain in the chest. She has had multiple similar episodes in the last few weeks. The blood investigation and ECG are normal in the past too. Investigation revealed no abnormality. What is the next best step? Option A, admit for detailed investigations. Option B, start counseling sessions. Option C, use beta blockers. Option D, use benzodiazepine for symptom relief. So the right answer is option D, use benzodiazepine for symptom relief. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 35-year-old female complains of increased anxiety and repetitive thoughts of her hands being contaminated and engaged in repeated washing of her hands. Her thoughts are distressing, but she is not able to overcome them. If she tries to hold herself from washing it further, aggravate her anxiety. What is the most probable diagnosis? Option A, phobia. Option B, forced thinking. Option C, obsessive compulsive disorder. Option D, generalized anxiety disorder. So the right answer is option C, obsessive compulsive disorder. बेसिकली तो ऑब्सेसिव कंपल्सिव डिसऑर्डर ऐसा होता है कि हमारे हाथ गंदे नहीं है लेकिन हमें थॉट आते रहते हैं तुम्हारे हाथ गंदे हैं, हाथ धो बार बार. तो दिन में इंसान 50 बार हाथ धो लेता है, तो उसे हम बोलते हैं ऑब्सेसिव कंपल्सिव डिसऑर्डर. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 37-year-old man reports that after suffering from sudden financial loss, he developed certain symptoms 2 weeks back. He started feeling fearful that someone is about to harm him. He could not sleep or eat properly. He also began to hear voices of a female, and that voice would abuse him and say that he was useless and should kill himself. His symptoms stopped after approximately 1 week. There was no relevant past history, drug abuse history, or medical history. What is the likely diagnosis? Option A, schizophrenia. Option B, schizophreniform disorder. Option C, brief psychotic episode. Option D, schizoaffective disorder. Schizoaffective disorder. So the right answer is option C, brief psychotic episode. चलिए बेसिकली जो इसका एक्सप्लेनेशन है, जब ब्रीफ साइकोटिक एपिसोड इज लाइकली डायग्नोसिस इन द सिनेरियो एज द सिम्टम्स आर प्रेजेंट फॉर लेस देन 30 days. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं फटाफट. अ चाइल्ड विद नॉर्मल IQ and learning skill for his age is weak in mathematics, reasoning, despite being tutored by a private tutor for 1 year. The child showed no improvement. What is the most likely diagnosis? Option A, ADHD. Option B, autism spectrum disorder. Option C, Asperger's syndrome. ऑप्शन डी स्पेसिफिक लर्निंग डिसऑर्डर। तो क्या आंसर है इसका फटाफट। सो द राइट आंसर इज स्पेसिफिक लर्निंग डिसऑर्डर। थोड़ा एक्सप्लेनेशन देखते हैं। The most likely diagnosis for a child who has normal IQ and learning skill for their age but is weak in mathematical reasoning despite 1 year of tutorial is a specific learning disorder in mathematics also known as dyscalculia। चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं फटाफट। A 30-year-old male is in the ward post appendectomy done 7 hours ago. He says he hears threatening voice in his head and is confused as to who this is. On assessment, his orientation is intact, vitals are stable. On further questioning, the wife she informed that he was a chronic alcoholic. What is the most likely diagnosis here? Option A, delirium tremens. Option B, acid transient psychotic disorder. Option C, delirium. Option D, alcoholic hallucinosis। क्या लगता है आपका आंसर? So the right answer is option D, alcoholic hallucinosis। चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं। An 18-year-old boy is brought to you by his concerned grandmother with a history of having experienced several episodes of jerking of the body the day before his final exam. There was no history, post-ictal confusion or tongue bite, and his investigation were normal. Which of the following conditions should be considered? Option A, malingering. Option B, factious, factitious disorder. Option C, somatization disorder. Option D, hypochondriasis। हंसेंगे पहले आंसर दीजिए। सो राइट आंसर इज ऑप्शन ए, malingering। थोड़ा एक्सप्लेनेशन देखते हैं इसका। Absence of muscle spasms, tongue thrusting, or post-ictal confusion, and normal investigation just before the final exam points toward the malingering। malingering। चलिए आगे बढ़ते हैं फटाफट। तो फैक्टिशियस डिसऑर्डर क्या होता है ये भी देख लेते हैं हम। फैक्टिशियस डिसऑर्डर बेसिकली द मुंचर्सन डिसऑर्डर भी, मुंचर्सन सिंड्रोम भी बोलते हैं हम इसे बेसिकली। It is the intentional production of psychic symptom to obtain medical attention, not a practical gain। चलिए आगे बढ़ते हैं नेक्स्ट क्वेश्चन पर। A 40 year a 40-year-old man presents with complaints of excess, uncontrollable worry over daily life activities, finance, and his health over the past 2 years. He feels restless all the time, complains of fatigue, disturbed sleep, and woke up once thinking and that his family met with an accident. What is the diagnosis? Option A, depression. Option B, illness anxiety disorder. Option C, somatoform disorder. Option D, generalized anxiety disorder। एक बार दोबारा रिपीट करते हैं क्वेश्चन। A 40-year-old man presents with complaint of excess uncontrollable worry over daily life activities, finance, and his health over the past 2 years. He feels he feels restless all the time, complains of fatigue, disturbed sleep, and woke up once thinking that his family met with an accident. What is the diagnosis? Option A, depression. Option B, illness anxiety disorder. Option C, somatoform disorder. Option D, generalized anxiety disorder. So the right answer is option D, generalized anxiety disorder. चलिए आगे कुछ नेक्स्ट क्वेश्चन बढ़ते हैं फटाफट. A student had difficulty in studies and on assessment he had an IQ of 55. According to the DSM-4 criteria, he or she would fall into which of the following categories? Option A, mild intellectual disability. Option B, moderate intellectual disability. Option C, severe intellectual disability. Option D, profound intellectual disability. So the right answer is option A, mild intellectual disability. So थोड़ा explanation देखते हैं. IQ of 55 is graded as a mild intellectual disability under DSM-4. Mild is 50 to 69, moderate is 35 to 49, severe is 20 to 34, a profound is less than 20. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Which neurotransmitter is involved in Alzheimer's disease? Which neurotransmitter is involved in Alzheimer's disease? Option A, acetylcholine. Option B, GABA. Option C, serotonin. Option D, dopamine. So the right answer is option A, acetylcholine. Basically, in Alzheimer's disease, there is a decrease in acetylcholine due to depletion of the cholinergic neurons. This is the reason for the defect in short-term memory. Next question. A non-alcoholic patient is brought to the emergency in a disoriented state. He complains of seeing snake and insect crawling on his skin. Which of the following should be given to the patient? Option A, haloperidol plus thiamine. Option B, lorazepam only. Option C, lorazepam plus thiamine. Option D, haloperidol only. So the right answer is option C, lorazepam plus thiamine. Basically, this scenario is towards the delirium tremens likely due to acute alcohol withdrawal. So the treatment is lorazepam plus thiamine should be given to the patient. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Which of the following is not a likely symptom of a panic attack? Lorazepam plus thiamine. चलिए नेक्स्ट क्वेश्चन बढ़ते हैं. Which of the following is not a likely symptom of a panic attack? Which of the following is not a likely symptom of panic attack? Option A, palpitation. Option B, fear of dying. Option C, chest discomfort. Option D, suicide attempt. So the right answer is option D, suicide attempt. Basically, the suicide attempt is not a likely symptom for panic attack. Palpitation, fear of dying, chest discomfort is the panic attack symptom. चलिए आगे बढ़ते हैं नेक्स्ट क्वेश्चन पर. Patient is the earliest पेशेंट सॉरी नेक्स्ट क्वेश्चन चलते हैं. व्हाट इज द अर्लीस्ट सिम्टम ऑफ alcohol withdrawal? What is the earliest symptom of alcohol withdrawal? Option A, tremors. Option B, delirium tremens. Option C, seizures. Option D, hallucinations. So the right answer is option A, tremors. So देखते हैं थोड़ा एक्सप्लेनेशन जो आगे भी इसमें ऑप्शन दिए हैं वो भी देखते हैं. The earliest symptom of alcohol withdrawal which develops around 6 to 8 hours post cessation of drinking. After 8 to 12 hours have passed, psychotic symptoms are seen like hallucinations, which are predominantly auditory in nature. Seizures are seen after 12 to 24 hours and can progress to delirium tremens at around 72 hours. चलिए आगे बढ़ते हैं नेक्स्ट क्वेश्चन पर फटाफट. Which among of the following deficiency is a common cause of cognitive impairment in old age? Which among the following deficiency is a common cause of cognitive impairment in old age? Option A, vitamin C. Option B, vitamin B12. Option C, vitamin B6. Option D, vitamin B1. So the right answer is option B, vitamin B12. Basically, the vitamin B12 deficiency can lead to cognitive impairment, especially in old age, as intake of food is less and nutrition deficiency occurs. And sometimes vitamin B12 deficiency is a common cause of reversible dementia. तो जो कॉज करते हैं डिमेंशिया रिवर्सिबल वो देखते हैं कौन कौन है. इंट्राक्रेनियल ट्यूमर रिवर्सिबल, सबड्यूरल हेमेटोमा, हाइपोथायरॉयडिज्म, ऑटो इम्यून एन्सेफेलोपैथी, विटामिन B12 डेफिशिएंसी, नियासिन डेफिशिएंसी, मेनिंजाइटिस, ट्यूबरकुलर, फंगल, मैलिग्नेंट. अब जो है इरिवर्सिबल, जो इरिवर्सिबल होते हैं अल्जाइमर डिजीज, हंटिंगटन डिजीज, लुई बॉडी डिजीज, वस्कुलर डिमेंशिया, क्रूज फेल जैकब्स डिजीज और पिक्स डिजीज. चलिए नेक्स्ट क्वेश्चन पर बढ़ते हैं. A female was recently diagnosed with mild depression. What is the preferred treatment for her? A female was recently diagnosed with mild depression. What is the preferred treatment for her? Option A, cognitive behavioral therapy. Option B, cognitive behavioral therapy and antidepressant. Option C, mild antidepressant. ऑप्शन डी, वेगस नर्व स्टिमुलेशन. फटाफट बताइए आंसर क्या है. So the right answer is A. You are right, Priyanka Sharma. The right answer is A. Cognitive behavioral therapy. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A patient stopped alcohol consumption for 3 days and presented with irritability, disorientation, paranoid delusion, agitation. A patient क्वेश्चन द्वारा स्टार्ट करते हैं. A patient stopped alcohol consumption for 3 days and presented with irritability, disorientation, paranoid delusions, agitation, visual hallucinations, and altered sensorium. What is the likely diagnosis in this case? Option A, delirium tremens. Option B, Wernicke's encephalopathy. Option C, Korsakoff psychosis. Option D, alcohol-induced psychosis. So the right answer is option A, delirium tremens. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 20-year-old lady presents with sudden palpitations, sweating, breathlessness, and a feeling like she is being choked. She had a history of a COVID-19 infection 1 year ago and fears she might die because she was positive for COVID-19. Physical examination, ECG, and laboratory workup were unremarkable. This is the first time she is experiencing an episode like this, which lasts normally for around 20 minutes. What is the most likely diagnosis? Option A, post traumatic stress disorder. Option B, bipolar disorder. Option C, depression. Option D, panic attack. जल्दी से आंसर बताइए. So the right answer is option D, panic attack. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 43-year-old man presents to the emergency department accompanied by police. He came to the police station accusing his daughter of wanting to kill him. The police on investigating, the family and the neighbors understood that if she was a false accusation, his physical examination is not remarkable. What is the most likely diagnosis here? Option A, delusional disorder. Option B, illusions. Option C, Cotard syndrome. Option D, hallucination. So the right answer is option A, delusional disorder. नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A 30-year-old woman brought to the psychiatric OPD by her friend says her boss is in love with her and stalks her. The woman's friend refuses her claim. What is your diagnosis? Option A, megalomania. Option B, delusion of reference. Option C, delusion of control. Option D, erotomania. चलिए दोबारा रिपीट करते हैं. A 30-year-old woman brought to the psychiatric OPD by her friend says her boss is in love with her and stalks her. The woman's friend refused her claims. What is your diagnosis? Option A, megalomania. Option B, delusion of reference. Option C, delusion of control. Option D, erotomania. So the right answer is option D, erotomania, not C. Right answer is option D, erotomania. तो देखते हैं एरोटोमेनिया होता क्या है थोड़ा. Erotomania is a delusional disorder where the patient believes someone is in love with him, her, against evidence of the contrary. So next question. A chronic smoker wants to quit smoking. Which of the following drugs would help him with his goal? A chronic smoker wants to quit smoking. Which of the following drugs would help him with his goal? Option A, bupropion. Option B, mirtazapine. Option C, varenicline. Option D, both A and C. So the right answer is option D, both A and C. Bupropion and varenicline are used for smoking cessation. Priyanka Sharma, you are right. Option D is the right answer. बेसिकली द ब्यूप्रोपियन और वर्नेसिलिन को हम यूज करते हैं स्मोकिंग छुड़ाने के लिए सिजेशन। चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं। A 39-year-old man reported that he washes his hand 15 to 20 times a day, to the point of it taking a toll on his workplace performance. He says this is due to repetitive thoughts that his hands are contaminated with dirt. What is the most probable diagnosis in this case? Option A, bipolar disorder. Option B, obsessive compulsive disorder. Option C, schizophrenia. ऑप्शन डी मैनिया। साथ के साथ वीडियो भी लाइक करते जाइए फटाफट और फटाफट आंसर बताते जाइए। सो द राइट आंसर इज ऑप्शन बी, ऑब्सेसिव कंपल्सिव डिसऑर्डर। नो, दिस टाइम इज रॉन्ग। प्रियंका शर्मा। चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं। लिथियम यूजेस इन प्रेगनेंसी कैन लीड टू विच ऑफ द फॉलोइंग टेट्राजोनिक इफेक्ट? Lithium uses in pregnancy can lead to which of the following teratogenic effects? Option A, cardiac defect. Option B, facial defect. Option C, CNS defect. Option D, urogenital defects. So the right answer is option A, cardiac defects. Lithium used in pregnancy can lead to cardiac defect. Epstein anomaly is the specific cardiac defect with lithium used in pregnancy. Yeah, you are right. Option A. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं। A young male patient who has a family history of bipolar disorder on his paternal side has come to your OPD with 3 episodes of mania. Which of the following mood stabilizers can be given to him as the most effective treatment? Option A, valproate. Option B, lamotrigine. Option C, olanzapine. Option D, lithium. दोबारा क्वेश्चन सुनिए। A young male patient who has a family history of bipolar disorder on his paternal side has come to your OPD with 3 episodes of mania. Which of the following mood stabilizer can be given to him as the most effective treatment? Option A, valproate. Option B, lamotrigine. Option C, olanzapine. Option D, lithium. Yeah, you are right. Option D, lithium. Priyanka Sharma, right again. Lithium is the right answer. जो आप सुन रहे हैं वही डिग्री है MBBS। काहे टेंशन ले रहे हैं आप, पढ़िए सिर्फ। A patient present in the ward when asked what is your name repeats the same sentence back to you. What is the phenomenon called? Option A, coprolalia. Option B, ecopraxia. Option C, copropraxia. Option D, ecolalia. So the right answer is option D, ecolalia. Basically, echolalia क्या होता है? Echolalia is a type of complex vocal tic where there is a repetition of last heard words of others. बेसिकली जो सुना होता है उसे बार बार रिपीट करता रहता है सेम चीज, तो उसे बोलते हैं हम इकोलेलिया। चलिए नेक्स्ट क्वेश्चन पे बढ़ते हैं आगे। A 38-year-old professor with depression request you to prescribe an antidepressant that would be least likely to cause sexual dysfunction, which of the following drugs would you prescribe? A 38-year-old professor with depression requests you to prescribe an antidepressant that would be least likely to cause sexual dysfunction. Which of the following drug would you prescribe? Option A, bupropion. Option B, escitalopram. C, venlafaxine. Option D, fluoxetine. So the right answer is option A, bupropion, because we can prescribe because it can decrease the chances of causing sexual dysfunction. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं इन द मेंटल स्टेट एग्जामिनेशन 100 minus 7 equals to 93 is done to examine which of the following mental function. Option A, judgment. Option B, language. Option C, orientation. Option D, concentration. So the right answer is option D, concentration, because these things are used in the concentration test. 100 minus 7 equals to 93 test is basically the mental state examination is done to test for concentration. चलिए नेक्स्ट क्वेश्चन में बढ़ते हैं आगे What is the most common symptom of cannabis intake? What is the most common symptom of cannabis intake? Option A, anxiety. Option B, depressed mood. Option C, dreamlike state. Option C, decreased appetite. क्वेश्चन दोबारा सुनिए What is the most common symptom of cannabis intake? Option A, anxiety. Option B, depressed. You are absolutely right. Priyanka Sharma is the right answer. Is the C, dreamlike state. Good. The most common symptom of cannabis intake is the dreamlike state. नेक्स्ट क्वेश्चन पे आगे बढ़ते हैं Which of the following does not suggest a medical cause of mental illness? Which of the following does not suggest a medical cause of mental illness? Option A, elderly age. Option B, loss of consciousness. Option C, auditory hallucination. Option D, acute onset. So the right answer is option C, auditory hallucination. Basically, the auditory hallucination is not suggestive of a medical cause of mental illness. Next question. You see a middle-aged man presenting to the psychiatry OPD who reports aliens have been speaking to him and telling him to kill his relatives over the past 7 months. What is the likely diagnosis? Option A, mania. Option B, delusional disorder. Option C, schizophrenia. Option D, brief psychotic disorder. Anas Khan, you are right, absolutely right. C is the right answer, schizophrenia. The patient has had auditory hallucination for the past 7 months, which makes the diagnosis of schizophrenia more likely of the given option. Which among the following is not a feature of pseudo hallucination? Which among the following is not a feature of pseudo hallucination? Option A, vivid in nature. Option B, not under voluntary control. Option C, no stimulus required. Option D, perceived in object space. Question दोबारा सुनिए. Which among the following is not a feature of pseudo hallucination? Option A, vivid in nature. Option B, not under voluntary control. Option C, no stimulus required. Option D, perceived in objective space. So the right answer is option D, perceived in objective space. Pseudo hallucination is the disorder of perception like hallucination. They are sensory deception without any actual stimulus. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. A patient a patient presents with sudden irresistible urge to do things that come to his mind. Which of the following best describes these symptoms? Option A, hallucination. Option B, illusion. Option C, delusion. Option D, impulse. A patient presents with sudden irresistible urge to do things that come to his mind. Which of the following best describe this symptom? Yes, you are right, Priyanka. Not C, is D. D is the right answer. D. Impulse. Option D is the right answer. Is impulse. The sudden irresistible urge to do things is called a impulse. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. Which among the following is the key feature of depression? Which among the following is the key feature of depression? Option A, loss of appetite. Option B, feeling of worthlessness. Option C, loss of interest in pleasurable activities. Option D, suicidal thoughts. Which among the following is the key feature of depression? Option A, loss of appetite. Option B, feeling of worthlessness. You are absolutely right, Priyanka Sharma. Is the right answer is C, loss of interest in pleasurable activities. Absolutely right, Priyanka Sharma. चलिए नेक्स्ट क्वेश्चन बढ़ते हैं आगे. A 34-year-old female presented to the psychiatric OPD. A 34-year-old female presented to the psychiatric OPD with low mood, loss of energy, loss of interest in pleasurable activities, decreased sleep, and appetite for the past 2 months. What is the most appropriate treatment to be started? Option A, lithium. Option B, sodium valproate. Option C, haloperidol. Option D, fluoxetine. A 34-year-old female presented to the psychiatric OPD with low mood, loss of energy, loss of interest in pleasurable activities, decreased sleep, and appetite for the past 2 months. What is the most appropriate treatment to be started? Lithium option A, option B sodium valproate, option C haloperidol, option D fluoxetine. So the right answer is option D, not C, fluoxetine. SSRI like fluoxetine are the most appropriate treatment for major depressive disorder. SSRI should be continued for 6 to 9 months after complete remission symptoms in case of single episode of depression. Next question. Which among the following dementia presents with Capgras syndrome? Which among the following dementia presents with Capgras syndrome? Option A, Alzheimer's disease. Option B, frontotemporal dementia. Option C, Lewy body dementia. Option D, vascular dementia. So the right answer is option C, Lewy body dementia. Not D, is C, Lewy body dementia. Capgras syndrome is the rare delusion of misidentification where the patient believes that someone close to him has been replaced by an imposter who look exactly the same. नेक्स्ट क्वेश्चन पे आगे बढ़ते हैं. A patient is obsessed with keeping herself clean. She washes her hand multiple times and is yet never satisfied with her cleanliness. She even refuses go out because she is afraid of getting contaminated. Which stage of development are these personality traits related to? Option A, oral. Option B, anal. Option C, phallic. Option D, genital. So the right answer is option B, anal. The patient has state of obsession and rigidity which point to a diagnosis of OCD. They are due to fixation in the anal stage of development. चलिए नेक्स्ट क्वेश्चन पर आगे बढ़ते हैं. चलिए तो आज के लिए खत्म क्वेश्चन. फिर मिलते हैं आपको किसी और दिन किसी और जगह नए क्वेश्चन नए सब्जेक्ट के साथ. थैंक यू फॉर वॉचिंग दिस वीडियो. अब प्लीज लाइक शेयर सब्सक्राइब करें हमारे चैनल को. थैंक यू. प्रियंका शर्मा प्लीज लाइक भी कर दें वीडियो को साथ के साथ. और अनस खान आप भी फटाफट लाइक कर दें वीडियो को.